This is not your ordinary YouTube video covering Lenire as a tinnitus treatment. Yes, you're correct. Lenire is supposed to be the best thing since sliced bread, with Neuromod's clinical research showing that over 86% of participants in their clinical studies showed a reduction in their tinnitus severity after 12 weeks of use. Now, I don't know about you, but I am always skeptical about the studies run by those that manufacture the technology. And I'm more keen on finding real-world data and understanding how effective this technology is at reducing tinnitus in real clinics using real audiologists in the real world. Well, my YouTube community, today I'm covering a second major set of real-world results, which includes just shy of 100 Lenire users in the US. And I kid you not, this data may well change how the world sees or how the world thinks about tinnitus treatment going into 2026. It certainly has here in the UK, with Tinnitus UK recently updating its treatment information sheets, upgrading Lenire's rating, and Neuromod reporting that this level of efficacy is currently matched only by professional CBT and hearing aids. So my video today is, as always, focused on you if you're keen on trying out Lenire, but also any of those audiologists who are thinking about adopting it into their practice as an offering for anyone suffering with tinnitus, which, having done so about a year ago, we're now starting to see the benefits with our patients in our clinic. For those of you that may well be new to the channel or new to Lenire as a concept as a whole, it makes sense for me to give you a brief overview on how this pretty radical tinnitus treatment actually works. So, to summarise, Lenire is a medical device designed to treat tinnitus by combining two different types of stimulation. Firstly, sound therapy, which is delivered through a set of headphones, whilst simultaneously providing mild electrical impulses via your tongue, using a tongue tip. Sounds pretty wild, right? And this isn't entirely new. In March 2023, Lenire became the first tinnitus device of its kind to receive FDA de novo authorization in the US. Since then, clinics around the world, including my own here in London, have been fitting patients with Lenire, with Neuromod, the team behind Lenire, telling me that worldwide, in total, there are over 250 clinics between both the US and Europe currently providing it as a tinnitus treatment. So in previous videos, I have already covered the clinical trial data that's come out from Neuromod, plus their previous real-world research based on data coming out of Alaska, home for one of the first clinics to start fitting Lenire. But this new research comes from Tobias and Petit Hearing Wellness, who are based in Boston, US, where 97 patients were treated with Lenire in a regular audiology clinic. And that last sentence is why this data is so important. This is just a regular audiology clinic. Of course, not trying to put you guys down, but we're not talking lab conditions here. And until now, there was only real-world research from one clinic, the Alaska Hearing and Tinnitus Center, which, whilst it was incredibly positive and showed 91.5% of more than 200 patients fitted with Lenire reported an improvement in their tinnitus, it was still only one site and one audiologist, and in my opinion, it's important that with any technology, there is as much evidence as possible proving its value. By the way, I previously interviewed Emily McMahon from the Alaska Hearing and Tinnitus Center for her take on why Lenire is such an invaluable tinnitus treatment, and I'll link that in the description to today's video. So let's dive into the results, and this is where it gets incredibly interesting. And if you want the full details, I'll post a link to the study in the description to today's video. But to cut to the chase, after 12 weeks, which is the standard minimum protocol for Lenire use, Hearing Wellness in Boston found that 84% of users showed a clinically significant improvement in their tinnitus on the THI scale. And to put that into context, 84% of Lenire users in the Boston study showed that clinical significant improvement, compared to 91.5% in the Alaska study. So that's two separate clinics, both outside of lab conditions, equally showing similar outcomes. But not only that, Boston took this one step further and also used another well-known scale to measure the effectiveness of this tinnitus treatment, the Tinnitus Functional Index, or TFI, if you've come across that, which also showed that 73% of patients reported a clinically significant improvement in their tinnitus. Now, why is that important? Well, now we have evidence that Lenire shows meaningful improvement across both of the two most widely used tinnitus measures. Let me expand. If you're really interested in geeking out on this, then you'll enjoy this part of today's video. The Tinnitus Handicap Inventory, or THI, is used to give us a broad overview of your tinnitus and the impact that it has on you on a day-to-day basis, giving clinicians an understanding on how much it interferes with your daily life, your concentration, and how stressed it makes you, plus how emotionally bothered you feel by it. In effect, it's great for us to have a big pictured snapshot on how debilitating your tinnitus feels for you. On the other hand, the Tinnitus Functional Index, or TFI, that I was talking about earlier, is far more granular. And you would rate your tinnitus from 0 to 10 across elements within your life, such as sleep, emotional distress, concentration, sense of control, or intrusiveness and quality of life. So loads of different factors. This makes it far more sensitive to smaller changes, and therefore small improvements or issues can show up far more clearly. So in reality, those clinics that use either of those two measurements, so the TFI or THI, can compare their current outcomes with other tinnitus treatments directly with what can now be achieved with Lenire. So the big question is, what does this mean for you as a tinnitus sufferer? Firstly, let me be absolutely clear. Lenire is not a cure for tinnitus. No treatment is. But when you see strong results from a study of 212 real-world patients in Alaska, strong results from a study of 97 real-world patients in Boston, demonstrations of this in both THI and TFI, plus recognition from Tinnitus UK, you start to see a picture forming that Neuromod are making waves. And this tech, which, being frank, when I first came across it, even I thought was a little bit out there, let's say, is now no longer an experimental fringe concept, but a treatment that is earning its place in mainstream tinnitus care. Now, I've got to be honest and share that there is a downside of this real-world evidence. I know, it was all sounding way too good, wasn't it? The limitation of any real-world study is that firstly, there is no control group, so this is just reporting on one group of patients and measuring their outcomes. Secondly, the type of tinnitus that these patients experience are not within the parameters of a study, which could be deemed as a positive and negative, I suppose. And thirdly, there could also be variable adherence, which I'm guessing in reality, again, could be deemed as a positive and negative, as you would want to know what happens in real life with this technology, not solely in lab conditions. And of course, there are still patients that didn't show an improvement in their tinnitus, but the majority did, and the consistency across clinics gives me increased confidence in treatment predictability, which is exactly why we offer Lenire in our own clinic. And if you want to hear more about the Alaska study, I'd recommend watching this video.